charged with dispensing federal relief and stimulus funds in a quick, transparent, and accessible manner. Their priority, which is a priority we all share, will be to provide relief for citizens across this state across a variety and a spectrum of needs. Today, I'm proud to appointed Banking Commissioner Jerry Little to serve as the Director of the Governor's Office for Emergency Recovery and Relief. Jerry has extensive experience serving our state, originally as a member of the New Hampshire Senate, where he served on the Fiscal Committee, and in late 2016 as Governor Hassan's appointment as the Commissioner of our Banking Department, where he currently serves. Jerry is prepared. He has already hit the ground running. And in the coming days, he will be forming his team, and we all look forward to meeting with some of the key stakeholders, whether they be small businesses, nonprofits, folks in the healthcare community, hospitals, wherever the need may be. And we know that this epidemic has created a need across, again, virtually everybody in New Hampshire. The unemployment insurance opportunities have been there for the individuals, and this $1.25 billion relief fund, essentially, that we're setting up, that can channel the opportunity that the federal government is giving the state of New Hampshire, will be able to meet on a one-on-one basis with a variety of the different stakeholders and make sure we're meeting those needs wherever they may be. I'm now going to turn it over to Commissioner Jerry Little for a few words.
Good afternoon. I am Commissioner Jerry Little. It's nice to see everybody. And Governor, thank you very, very much. I am humbled and honored by this. It's an immense task, and I am ready to get to work on it. I strongly believe in transparency in government. We will do this assignment with a lot of communication with all of you, with the people of the state of New Hampshire. We'll have a lot of conversations with stakeholders and with legislators to make sure that everybody understands where the money's going. We will put metrics in place to make sure we can prove to you that the money went for the purposes it was intended for. Thank you, Governor, very much for this honor.
You bet. Thank you, Jerry. I guess we'll call you Director now. I'm now going to invite Dr. Benjamin Chan to come up to give a brief update on the state of the public health update, as well as a presentation on some of the modeling and the variables we use when helping make our predictions and figure out where we're going as a state. Dr. Chan.
Governor, thank you very much. I'm going to try not to disrupt the computer too much up here. Great. Well, good afternoon. There's been a lot of questions that have been coming to public health and state government about what we can expect from COVID-19 in New Hampshire in the future. And so I want to talk a little bit about modeling and what models can potentially show us and what New Hampshire data right now is showing us. But first, I want to give you just the routine update that I routinely give during these sessions. There have been over 9,900 people that have already been tested for COVID-19 in New Hampshire, over 150 people underway, testing that's underway at our public health laboratories, and we have a total of 819 people confirmed with COVID-19. That's an increase of 31 from what we announced yesterday. 127 of these people have required care in a hospital or hospitalization. That's an increase of 9 individuals from what we reported yesterday. And sadly, 21 people have died from COVID-19 infection. We believe at this point, as I've said in the past, that COVID-19 is widespread in our communities. And so we urge people to heed the recommendations and the precautions for social distancing. So with that, let me jump in and make sure the technology is working here. So what is the future of the epidemic of COVID-19 in New Hampshire, right? That is the big question, what people want to know. Before I jump into some of the data, I want to make a few important highlights here. Mathematical models, what we call modeling, can help predict the COVID-19 epidemic so that for the purpose of directing resources and ultimately saving lives, right? That's why we do the work of public health and as a community to stop the spread of COVID-19. Now, early data from our New Hampshire strategy appears to show early signs that we are starting to control the outbreak of COVID-19, what you will oftentimes hear to as flattening the curve or bending the curve, and I'm going to show you some of that data in a little bit. But it's important to continue to work together to protect everyone in our state, especially those who are most vulnerable from infection, and to continue with our social distancing. This is the critical time to continue to do that so we can continue our efforts to control the spread of COVID-19. So let me first start by addressing this question of what is community mitigation. This is a phrase that you hear frequently us use and others in our community and nationally use. Community mitigation really is a package of actions that don't involve, medicines or vaccines like we have for some other infections like influenza. And our community mitigation actions are important for stopping the spread of COVID-19. Now, many of these actions listed here on the slide, in fact, all of them are steps that New Hampshire has taken in the absence of a vaccine, in the absence of medications to control and limit the spread of COVID-19 in our state. That includes instructions that everybody, if it's not urgent for them to go out, to stay at home. If people are going out, for example, to the grocery store or a doctor's office, they need to maintain social distance. That's at least 6 feet from other people. We have moved to remote learning for schools, encouraged telework for businesses, canceled mass gatherings, and closed non-essential businesses. All of these have been early interventions that have been taken and extensive interventions for the sole purpose of slowing the spread of COVID-19. This is what we call community mitigation. Now, the goals of community mitigation are fivefold. First, we want to slow how fast COVID-19 is spreading. We want to spread out when people get sick, so what you oftentimes hear as delaying the peak of the outbreak. We want to reduce the overall number of people infected with COVID-19, obviously decrease deaths. We want to save lives and prevent overwhelming our healthcare system. So in this graph, on the horizontal axis, you can see days since the first case of COVID-19, and on the vertical axis, the daily number of cases. And this is a graphical representation of a pandemic where there are no interventions, no community mitigation, no social distancing. And you can see that there's day by day a very dramatic increase in the number of cases of COVID-19 until it reaches a peak and then a rapid fall off. Now, a situation like this would dramatically overwhelm our healthcare system, would lead to a great number of cases and potentially even deaths. And so the goal of community mitigation are combined layers of interventions with the purpose of slowing the spread of COVID-19, decreasing that peak, spreading out the outbreak, helping to prevent our healthcare system from becoming overwhelmed. Each individual action in and of themselves can have an effect, but it's really the combination of all of these actions together that I highlighted on a previous slide that is important for really having effective control of COVID-19 in our communities. Now, these next couple slides are diagrams that are meant to be examples of the potential magnitude of impact of our community mitigation efforts. They're not meant to represent what we think will actually occur. You can see, again, a similar graphic to what I just displayed, days since first infection on the horizontal axis and the daily number of cases on the vertical axis. And this is a hypothetical scenario, but with no interventions, some early modeling estimates showed that we could have tens of thousands of COVID-19 infections in New Hampshire. Now, that's all infections, that's not just diagnosed infections. But we know that what we call case fatality rate, that's the percentage of people who end up dying from COVID-19 infection, is approximately 2%. That's consistent with global data as well as data within the United States and New Hampshire data. And so if there were 40,000 COVID-19 infections in New Hampshire, we would expect approximately 800 people to die from COVID-19. Now, with community mitigation, with our efforts to slow and control the spread of COVID-19 in our communities, we can substantially decrease not only the number of infections, but the number of deaths. This goes back to what I was saying, that the goal of our efforts in the absence of a vaccine and the absence of medications is to save lives. That is why we have taken the extensive measures that we have already taken. And likely, given the early intervention, the number of actual cases and the number of deaths we expect to probably be less than this at the peak of our outbreak. There have been modeling studies that have come out of, for example, the Imperial College of London that have demonstrated that combined community mitigation efforts and social distancing can cut the death rate by at least half, which is what's demonstrated here. It's not just lives we're trying to save, we're also trying to prevent a surge on our healthcare system and overwhelming our healthcare system. Modeling studies have also shown that we can effectively decrease the burden on our hospitals and healthcare systems by up to 2/3 or more. Again, these are hypothetical numbers that are consistent with some of the earlier modeling studies, but we believe that the peak on our healthcare system is likely to be less than this based on some of the early data that we're seeing, and I will share that in a minute. And again, the purpose is to decrease that peak to a level where we have appropriate healthcare resources like hospital beds and ventilators to manage the potential influx of patients who come down with COVID-19 who may need hospitalization and even critical care medical attention. So if our social distancing efforts and community mitigation strategy is strong enough, we could potentially stop the outbreak altogether, what we call outbreak suppression, which is highlighted in this curve. So there's a range of possibilities that we could see as this outbreak progresses. And unfortunately, models are not entirely accurate. And the purpose of those models is to help us predict and plan so we can address worst case scenarios. Now, just a quick mention about relaxing our social distancing. If we are successful at controlling the outbreak or even suppressing the outbreak, there will come a time where we will need to talk about relaxing social distancing, but that time is not now. If we relax our social distancing too quickly, we risk having the outbreak increase again or risk having subsequent outbreaks, which we then need to respond to. Now, this is an example here out of the Institute for Health Metrics and Evaluation at the University of Washington. This is a model that has been talked about frequently in the national media as well as more locally. This is a model that has been put out in public and is being updated routinely. And I put this out there as an example of a model. This is looking at the national hospital resource use. In the red dotted line, it shows all the hospital beds that are projected to be needed in the United States. In the green line, the number of ICU beds that are estimated to be needed. And in the upper right-hand corner, you can see the estimated bed and ICU bed shortage that is estimated in the United States. These models have estimated that the national outbreak will likely peak at some point in the next week or even the next few days. But I want to highlight that these models are constantly changing based on new data that are fed into the models. And even just a couple of days ago, these estimates were substantially higher than what is being displayed currently. So we have, and I have, looked at many different models, and there isn't a single model that I think accurately predicts the future of COVID-19 in New Hampshire or even nationally. Again, these models are constantly changing and constantly being updated. But based on the models that I have reviewed and our New Hampshire data, we believe that there's a high likelihood for a potential peak in New Hampshire sometime within the next several weeks. We're basing this off of models we've looked at, but also New Hampshire data, and looking at where we are now in the epidemic. I'm hopeful that we can be successful at minimizing the impact of COVID-19 on our communities with ongoing collective help of state agencies, local partners, and community members. So let me turn now to looking at some of our local data here to highlight some key points. This is a graph looking on the horizontal axis, looking at the date compared to the vertical axis, which looks at the number of COVID-19 cases per 100,000 people. This compares the different states in New England. And you can see that Massachusetts and Connecticut have the highest rate of COVID-19 infection. Again, this is taking into account population size. And New Hampshire and Maine are at the lower end for rate of COVID-19 infection, which is good news for us. I'll also point you to the light blue line here, which is the New Hampshire line. And you can see that the curve is not exponentially increasing, as we have seen in some other areas of the United States, but rather starting to what we call bend the curve. And I think that this is some early and potentially hopeful news, and we want to see it continue this way, and we will obviously be following the data very closely. This next slide is looking at an epidemic curve of confirmed COVID-19 cases in New Hampshire. And this is looking at the data a little bit differently. This is graphing the number of people infected per day of COVID-19. This graphs the number of people infected based on the date of illness onset. And you can see in the gray shaded box, hopefully on the screen, what we label a period of uncertainty. This period of uncertainty is because the data and the numbers are still changing within this 2 or 3 week time frame. Because this is the incubation period of the virus, it can take up to 14 days or 2 weeks from when someone is exposed until when they develop symptoms and go in for testing potentially, and then there's a delay with reporting. So in this 2 to 3 week window, we expect the case counts, the number of people confirmed with COVID-19 to potentially be changing. But you can see that, again, we are not seeing a dramatic increase in the number of daily cases that are being reported to public health based on date of illness onset. And in fact, if you look at this relative to where certain actions have been taken, on March 13th, the governor declared a state of emergency. On March 16th, just a few days later, there was cancellation of mass gatherings and closure of certain businesses like restaurants, and a move for schools to go to remote learning. And then on March 26th, there was a closure of all non-essential businesses and a stay-at-home executive order. Now, it takes 2 to 3 weeks for any of these actions to really be seen in the data, really to start to see the impact of some of these social distancing measures that we have put in place. And so while we have certainly, I think, seen some of the effects of the early interventions of moving schools to remote learning, limiting mass gatherings or canceling mass gatherings, I think we still have yet to see the full impact of the stay-at-home order and the increased social distancing interventions that have taken place over the last couple of weeks. And so I think that this provides some helpful information as we follow these numbers for how this outbreak is going to proceed into the coming couple of weeks. Now, one of the comments I know people are going to have as well, maybe the numbers are decreasing or not increasing as much simply because we're not testing as much. This is a graph that is looking at the number of people tested each day in New Hampshire. Again, on the horizontal axis, we have the date of the reported test result, both positive and negative test results. And on the vertical axis, the number of people tested. You can see that there was an initial dramatic increase in testing. It has declined a little bit, but the last week we have averaged about 400 tests per day. This does not include the most recent data from yesterday, where there were over 400 tests conducted in New Hampshire that have been reported to us. And so if you look at the data over the last week, we've been holding steady at about 400 tests per day. Now, it's not just total case counts. As I mentioned, the number of people infected with COVID-19, the number of confirmed cases, can be biased by testing, as I think we all realize. And so it's important to look at other data as well. We have data looking at hospitalization numbers. This is potentially a more reliable source of data because anybody that is hospitalized with suspect COVID-19, we have asked healthcare providers and healthcare systems to test. We don't want people coming into the hospital with undiagnosed COVID-19 because there's the potential for spread in our healthcare systems. And so this is a graph by day showing the daily hospital census. So for example, yesterday there were 65 people in all of New Hampshire hospitalized with COVID-19. The day before that, there were a total of 68, then 74. And if you go back, there was a period of 5 or so days last week where our hospital census for COVID-19 hospitalizations was stable. So again, I think that this data, again, points to potential impact of our social distancing and community mitigation at helping to flatten the curve, so to speak. We're not seeing an exponential or rapid acceleration in the daily hospital census for COVID-19 admissions. I started off talking about wanting to save lives and prevent deaths from COVID-19, and that still certainly is a priority of ours. This is a graph looking at the total number of COVID-19 patients in New Hampshire who have died. This is looking at cumulative numbers. So if you look at April 9th, there are a total of 21 individuals who have now died in New Hampshire from COVID-19. So this is certainly a concerning trend that we're following closely. The last few days especially, there have been an increasing number of deaths from COVID-19 in New Hampshire, which is unfortunate. This is very hard on the families and individuals affected by these deaths. But I want to point out in this next slide, this is looking at COVID-19 deaths each day in New Hampshire. About half of the deaths in the last few days have been associated with long-term care facility outbreaks. I want to make this point because this is exactly the population that we are trying to protect. Each and every person that is represented on this slide is part of the higher risk or more vulnerable group, more vulnerable to bad outcomes from COVID-19 infection. All of these individuals are either over the age of 60 or had multiple medical problems. And unfortunately, from what we've seen in other states, including in New Hampshire now, once COVID-19 gets into some of these congregate settings like long-term care facilities or assisted living facilities, the consequences of these can be devastating. And I think this is part of the reason for the increasing number of deaths from COVID-19 that we have seen in the last few days. And we are working with these facilities that have experienced outbreaks. I know this was mentioned, I believe, yesterday, to try and help them bring these under control and prevent further deaths. We will obviously keep following these numbers closely, but our ultimate goal here is to prevent these types of bad outcomes from COVID-19 infection. So in summary, let me just say that I think based on what we're seeing in the data and what we've seen in some of the modeling studies, that this epidemic we expect will last many more weeks. Our New Hampshire strategy is showing some early signs of potentially having an impact on slowing the spread of COVID-19 based on not only the total numbers of cases of COVID-19, but also looking at hospitalizations. We still, however, need everybody to stay at home to protect others, especially those older adults and people with chronic medical conditions in our communities who are at increased risk of needing hospitalization and possibly even dying from infection. And the models and our own New Hampshire data, I think, suggest that now is the critical time to continue with our social distancing and community mitigation strategy. We know that this is tough on everybody. It's tough being confined to the house with kids that are not going to school anymore but are undergoing remote learning. We know that this is having an impact on families and income and even emotional and mental health. We want to thank everybody for the work that they're doing to stop this and control the spread of the novel coronavirus. And please continue with these measures that we have recommended, and hopefully we can bring this outbreak under control. And you've heard phrases like flatten the curve and bend the curve. Well, one of the new ones is hopefully we'll see the backside of the curve sometime in the coming few weeks. So thank you very much.
Well, that was terrific. Thank you, Dr. Chan. As always, you always learn something new when Dr. Chan takes the stage. I love that. Before we take some questions, I just want to take a moment and highlight a kind of a third subject we want to touch upon today. Some of the really good stories that we've seen come out over the past couple weeks, aside from some of the hopeful data that we're finally seeing. A few weeks ago, we put out a call to Granite Staters who wanted to really give back in some way as individuals or even as corporations in terms of donating or volunteering to what we know is a very worthwhile cause. We called on Granite Staters who were able to give or donate to authorized COVID relief funds. And since launching those efforts, we're announcing today that over $3.2 million have been raised, with over $700,000 donated through the Granite United Way for direct support to families in need, with over $2.5 million coming through the New Hampshire Charitable Foundation that go directly to nonprofits throughout the state. So just a terrific start on both fronts. $3.2 million raised in just a few weeks here is just, it really is awesome, and I think it speaks to the incredible charitable nature of the Granite State. Another area that we're proud to announce today is the New Hampshire Nonprofit Response Fund, and that's a joint effort between the Community Development Finance Authority and the Business Finance Authority, two government agencies here within the state that will provide nonprofit organizations with resources up to $100,000 for working capital, equipment purchases, and programming expenses. Again, using the BFA and the CDFA's financial power to provide up to $100,000 specifically for nonprofits. We know that New Hampshire nonprofit organizations, they're on the front lines of this epidemic in so many different programmatic ways, and during these difficult times they play a very critical role in our communities. From the smallest of towns to the Nashuas and Manchesters, it's these nonprofit organizations that are so often making that one-to-one connection with individuals that are in need. So ensuring their ability to continue delivering critical services now and into the future is a core mission of this proposal and paramount to the well-being of our Granite Staters. And again, we just want to thank the CDFA and the BFA for putting these opportunities together, get them up and running, not over a matter of weeks and months and through lengthy bureaucratic processes, but with the immediacy that this crisis really demands. So we cannot thank them enough. I also want to mention that finally 2 weeks ago, we called on Granite Staters to answer the call just to volunteer. A lot of folks that may want to just volunteer in their communities. Over 1,300 people to date have stepped up and signed up with the Volunteer New Hampshire website. You can, if other folks are interested, they can call the Volunteer New Hampshire hotline at 271-7200. That's 271-7200, or visit the Volunteer New Hampshire website itself just to click on the link and put your name into the mix to volunteer. And it isn't just volunteering here in Concord; it's really all over the state. They're going to match you with what the ways that you think that you can help with local organizations or opportunities in your community. And with the fact that 1,300 individuals have stepped up already in just the first couple of weeks. Again, a great testament to the people of this great state. We are a great state. We're an amazing state with amazing people, and because folks generously donate their time and their resources, it definitely keeps going back to that issue I talk about a lot as I close a lot of these press conferences. It's not just about hope. It's not about false hope. It's the reality that when we come together, we make those sacrifices, we volunteer our time, donate where we can donate, understand that we are truly all in this together as individuals, as communities, as nonprofits in the private sector. When we do that, really amazing things come. And the proof is in the pudding. We saw in the presentation just a few minutes ago with these sacrifices that we're making, these mitigation efforts that we're doing, whether we're talking about essential or non-essential businesses, whether we're talking about social distancing, remote learning, all of these add up in an incredible way with real results. We would not have these results that we're seeing today if not for the very difficult decisions and efforts that not just we took here in Concord, but that the citizens of New Hampshire accepted, took on themselves, and took that responsibility very seriously. So again, we cannot thank the citizens enough. We have a long way to go. There's no doubt about it. This isn't going to be an evenly distributed bell curve, as you saw up here. There's going to be a bit of a tail, and we're going to kind of bounce around. And when we're on the back end of this curve, we want to get to that back end. And where the curve ends, when it finally hits zero, we don't know. But until then, we all have to remain very vigilant in terms of our responsibility to ourselves and our family and the public health and safety of our homes and our communities. The stay-at-home order is working. It's very tough to do, we understand, but it is working. The non-essential business order is working, and the remote learning is having a wonderful, creating a wonderful opportunity for our students, but also working to help prevent the spread and ensuring public health and safety. So we can't thank folks throughout New Hampshire enough. With that, we can open up for questions for whatever folks may like. Adam.
The national surge timeline has moved up a little bit over the last couple of days. Do you anticipate, and we heard Dr. Chan saying it could be in the next several weeks, but do you anticipate that peak of late April, early May moving up at all to match what we're seeing in some other states and nationally where they've kind of said, okay, sure, it's going to be a little bit sooner?
So the question is, will the peak that we originally predicted as potentially late April or early May? Dr. Chan, why don't you come up? Because I'm going to put here. Whether the peak that we're predicting in late April and early May is predicted to move up as well. I think it's safe to say that we hope so. Right now the data looks like that may be the case, but before I bring Dr. Chan up, I just want to remind folks, this could spike at any moment again, right? And that's exactly what we're trying to avoid, a kind of a re-spiking because we get too lax in our behaviors and too lax in the ability to go out and our willingness and wantingness to go out and go back to the large gatherings and things of that nature. So we have to be incredibly careful that we don't hit that. And if we are, I do believe that surge timeline could be moved up, which would be a very positive thing. But I'll let Dr. Chan answer with the details.
Yeah, thank you. It's a good question, and as you've seen, for anybody that has followed this model from the University of Washington, that the timeline and the numbers are constantly changing, even on a day-to-day basis. And I think that highlights the difficulty with using models to predict in any precise way when we're going to see a peak or how high of a peak we're going to see. And so it's really difficult to say. And for that matter, what Governor Sununu mentioned is likely true, that it's unlikely to be a bell-shaped curve, right? What we see with a lot of outbreaks is that we see an increase, then it might plateau for a little bit of time, maybe going up and down over a certain set point before it finally decreases. And so our outbreak in New Hampshire is not going to likely look anything like or exactly like what the models are showing. We believe, based on the data that I showed, based on what a number of different models are saying, including the University of Washington model, that the peak there's a good chance that it will be sometime in the next several weeks, but where in there, it's always difficult to say.
Dr. Chin, I wonder if I could piggyback on Adam's question there. We saw 31 cases today that you announced today. A couple of previous days we saw cases in the 40s, when we had been seeing cases in the 50s. So, to borrow a term the governor has used, how long does that need to last for you to say, this is not a data point, this really is a trend, that we're in the right direction and it's going to continue this way as we, further bend this curve?
Yeah. So the question is, how long do we have to follow the data before we can say that we believe it's trending down or it's going down? Sorry, I just messed with the screen there. And I think there isn't an exact number or timeline, right? As I mentioned, we may see it go down. Likely we're going to see days or even periods of time where it might go back up even. And so really it has to do with the trajectory of this over not just days, but the next several weeks before we can make any comments about whether it's trending down or truly staying stable or going back up. And it may plateau, as I mentioned, for a while, for a number of days or even weeks.
Half the people who have died were in long-term care facilities. 26% of infections are people, healthcare workers. How big a problem are those facilities going to be in terms of containing COVID-19, and how central a concern should those be to the public?
So the question is, the facilities, like the long-term care facilities that are experiencing outbreaks, how central of a concern should they be? I think the concern really is more for the people that live and work in those facilities, right? Our long-term care facilities have taken extensive measures to start using personal protective equipment and, testing patients and early recognition of symptoms to try and prevent the virus from transmitting within those facilities. For that reason, I think so many of these residents are confined to the facilities. They're not going out into the community very much. Certainly, we have to be vigilant for our healthcare providers who are going in and out of the facility, not only to protect the healthcare providers, but also to closely monitor people that may be at higher risk for symptoms, and if they come down with symptoms, to test. But this is part of the reason for the social distancing and the stay-at-home orders, right? So we can never predict who's going to come down with infection or who might be shedding the virus from their respiratory tract before they develop symptoms. And so everybody needs to be following very closely the recommendations of staying at home and only going out if it's urgent, if they need to go out for essentials. Because whether it's a healthcare worker or somebody in an assisted living facility or your neighbor down the street, for example, We believe the virus is circulating in our communities, and the reason for the social distancing is to help prevent transmission from one person to another.
Some of the facilities that have been identified, a lot of workers were infected. Presumably those people are no longer on the job. Those jobs are hard to fill.
Yeah.
Where do we get the workforce to fill those? And what happens when those people have to circulate from facility to facility?
Yeah, so a number of questions in there about the workers that have come down with infection and how to fill the staffing needs of those facilities and prevent people from transmitting it between facilities. So what I can say is that the recommendation is not to float staff between facilities for the exact reason that you highlight, that someone can bring it from one facility to another facility. And so we're working with long-term care facilities and other healthcare facilities to make sure that they have the best processes in place to try and prevent transmission from one facility to another. In terms of staffing issue, this remains a problem. I don't know if the governor wants to comment on this, but we have a volunteer workforce that we're looking to. The commissioner of Department of Health and Human Services is looking at how to bring additional staffing support to these facilities. So that is an active area of we're trying to look to how to support these facilities.
She identified, she said that at least 10, and she actually said dozens before she amended that to say 10 yesterday. So is there anything more you can tell us about the number of other facilities where COVID is at work?
Yeah, so I don't have an exact number. I believe what the commissioner shared with you yesterday is probably the most updated information.
There's a big difference between dozens and 10. So that's if you listen to the tape, what she said dozens, and then she said 10. That leaves a pretty wide range.
Well, I can't comment on what the commissioner said yesterday. I would defer you to her.
So, Governor, can you say anything about that?
Yeah, I believe she said dozens, and then when she looked back at the number, she said no, it's probably more accurately, the more accurate number is probably more like 10. So I do believe 10 is the close, is very much in line with what the reality is. It's more like 10, yeah.
Governor,
But just to be clear, we have dozens of facilities across the state, and so we're constantly monitoring dozens of facilities. But where, I think to your point, where we have potential active COVID cases is the 10 that we're really highlighting a lot of our efforts on to ensure that one case does not become an outbreak, and that's the real concern.
your insurance commissioner announced it today, but I wondered if you could speak to this development with regard to out-of-pocket costs for COVID-19 treatment, with so many major healthcare carriers, right, essentially waiving that out-of-pocket cost.
So the question is about who can pay and who would be on the line for out-of-pocket costs for those who have insurance, and the fact that the private insurance companies are stepping up and waiving those costs and those co-pays and things of that nature. It's a great opportunity for the people of the state, and just another example of everyone knowing that they have to pitch in. Whether you're an insurance company, whether you're a hospital, whether you're on the front lines, everyone's doing their part, and so we greatly appreciate their assistance, and not for the state, but for the individuals who would have to pay otherwise some potentially pretty hefty out-of-pocket costs. Yes, sir.
Do you mind if we bring Dr. Chan back up for a question on hospitalizations with the graph that you showed? I don't know if we can bring that back or not at this point, but the entire idea there, were those numbers, because you started talking about hospitalizations, but then you mentioned the confirmed cases. So were those hospitalizations for a respiratory illness of some kind, or was that all confirmed COVID-19?
That was all confirmed COVID-19 in the hospital, yes.
Do you have a more, wouldn't it be, I guess, are you sure you're capturing everything there within those numbers? And how close do you think that is to the reality of the, those acute cases of COVID-19?
Yeah, so the question is how accurate are these numbers, I think, on hospitalization and in terms of the reality?
Representation and spread of COVID within the state.
Yeah. So, remember that we estimate that about 15 to 20% of people with COVID-19 will require hospitalization at some point. And we obviously haven't gone out and tested every single person with symptoms, and so the there is the total number of confirmed cases in the state can give some evidence for the trajectory, but there's limitations. There's what we call testing bias. The hospitalization numbers are going to be a much more accurate way to track this because people that come into the hospital with suspected COVID-19 can and should and are being tested. And let me actually mention, I meant to say this earlier, is that this data is provided by the New Hampshire Hospital Association. And so we want to thank the New Hampshire Hospital Association for working with us and the hospitals to try and put out some of this data. What I've graphed here, what the New Hampshire Hospital Association has graphed here, is confirmed COVID-19 cases in the hospital. They also tracked suspect cases of COVID-19 in the hospital. And while this graph that is being displayed here has actually showed some stabilization, the number of suspect cases in the hospital have actually dropped. Right, so it's not an issue of we're seeing increased suspect cases in the hospital that are still pending testing. I think when you look at the data as a whole, it's not only that the confirmed cases that are being hospitalized show some signs of stabilization, but the number of suspected people that are undergoing testing in the hospital is also not increasing. If anything, it's dropping.
On another slide where there's comparisons between New Hampshire and other states, does that, there was one where there was a rate, yeah, I mean, does that account for different rates of testing per population? I mean, is that?
Good. So the question is, does this graph count for different rates of testing in the population? And the answer is no. So and this is what I was alluding to before, is that numbers of whether we're looking at total numbers of cases or rates of COVID-19 infection, these numbers can be affected by testing. Right, so a test a state that does more testing will identify more people with COVID-19, and so you'll see not only higher numbers of infection but also higher rates.
Our rate compares to those other states represented there.
In terms of testing?
Yeah.
So the question is, how does our rate of testing compare with other states? I don't know exact numbers or comparisons of testing between states. What I will say is that most, if not all, states are in a similar position to New Hampshire in terms of needing to prioritize testing to some extent, given the limitations, not in test kits. Right? There's been a lot of testing machines and test kits rolling out, but it's the chain of supplies that are needed to conduct testing, the personal protective equipment, the nasal swabs, the nose swabs, the solutions to transport specimens, the extraction kits before we can actually reach the testing stage. All of those supplies are in short supply across the country and other states, and so all other states are struggling with this exact same issue that we are.
Can you go back to the facility care death number versus regular patient death number chart for a second? So yesterday it was, so how many of today's 3 added deaths are from facilities versus, say, normal population?
The 3, as is highlighted here, the 3 additional deaths from today are included here, and none of those are associated with a long-term care facility outbreak. Where those people were when they ended up passing away, I can't speak to specifics, and I don't actually know.
Sure. So of the non-facility care deaths, nearly, I think, all but a couple in your releases have been over the age of 60 and or had underlying health. How many of those did not have underlying health and were under 60?
So the question is, how many of the 21 deaths in the state were under the age of 60 and did not have underlying health conditions? The answer to that is 0. All of the people represented on this slide, the vast majority of these individuals were over the age of 60, and everybody else who's not over the age of 60 had known chronic underlying medical conditions.
Okay, thank you.
Yeah.
Can you also go back to the epidemic curve which showed the peak? Yep, thank you. So you said, and I think you said 2 to 3 weeks before these numbers are charted, something happened. In other words, that was the incubation period and the testing period. Am I to understand that correctly?
I'm not sure.
So, okay,
Can you maybe
so
finish your
March
question?
20, it looks like March 23rd, you have the largest number of reported positive cases. So the incubation period for anybody who had met somebody or somebody in the family or somebody was infected around those was 2 weeks, and then there was then you said 2 to 3 weeks, so I'm assuming 2 weeks of incubation and a week of testing, right?
Reporting.
Okay. Sorry?
There's a delay between when someone develops symptoms, they get tested, and then they're reported to public health for
Thank you.
investigation. Yeah.
So what happened, in your opinion, 21, so the first press conference you had with all of us at Hazen Drive was a couple of days after your first positive at the end of February. So if you go back to the largest numbers of cases that have been reported, which looks like March 15th, March 18th, and March 24th, do you have any information on what happened between the 2 to 3 week period of those period, which takes us into February, before the first case was reported in the Grafton County case, and then the person who knew the Grafton County case?
So the question is, do we know of anything that happened in the time period between some of these higher days of cases? Let me first clarify one thing. These are date of illness onset. So someone can be tested a week or two later. We graph this based on when the person reported developing symptoms. And so I think what you're going to see, this is what I was referring to earlier, is that you're going to see natural variation in these numbers. They're going to go up, they're going to go down, they're going to go back up, they're going to go down. So the ups and downs are expected. What causes the ups and downs, most of the time, it's difficult to say. One thing I can mention is that obviously testing is going to impact the number of cases that we identify. And so if you look at this graph, we were ramping up testing during that time. Our peak date of testing was, these were the dates that the results were reported, was at the end of March. So these higher numbers are actually before we had ramped up. Testing had, peaked, so to speak, but testing can certainly influence these numbers. Whether that was what contributed to these higher, numbers on specific days, it's difficult, if not impossible, to say.
Also clearing out the backlog.
Right, we were also clearing out the backlog of some of the testing that we had done. Yeah.
Can I just ask one more follow-up? So one of your predecessors described epidemiology as a disease detective. Can you take a minute and just describe what, if any, process you and your team go back through? Okay, everybody's now well. Do you then go back and start re-interviewing everybody to find out how all of this came? Because the first cases were in Grafton, and how they go from, everybody came back from Italy on school vacation, and then you have half the deaths in the state are from living care facilities. That doesn't really, Grafton County trip, school vacation trips, half the deaths in living care facilities. There's almost no connection, it seems, to me, how all those people got sick and died based on that. Do you know what I'm saying?
Yeah, so the question is, if I can rephrase this and repeat it for everybody to hear, is that how do we conduct these in public health investigations and try and connect cases? How do we make that connection? And that is in fact what we try to do. Certainly we were doing that early on, and I can say that our public health team continues to investigate each and every confirmed case of COVID-19 that is reported to us. Because of the volume of infections, many other states have done away with those types of investigations. We continue to have a group of people that conduct those investigations. Early on, we try and make those connections, but when we have a pandemic like this, it becomes impossible to be able to make connections between each person and figure out where exactly they got it from. Certainly we ask about risk factors when we do these investigations. We ask about travel, although, there's risk in our own communities for acquiring COVID-19 because we believe it's more widespread. We ask about whether someone was a close contact to someone with confirmed COVID-19. But at the end of the day, as this virus becomes more prevalent in our communities, the identified risks, we become less able to identify these connections. And so that is something we try and do, especially early on, or when there's limited outbreaks. For example, other viruses, mumps and measles, and we try and make these connections because it helps us trace back the chains of transmission and contain the infection. But in this case, the goal is no longer containment of the virus. The goal is to slow the spread. And if we can be effective in our social distancing so that for each person who becomes for each person that becomes infected, fewer than one additional person becomes infected, that's how we suppress the outbreak and get it to stop.
Do we have any sense of how many confirmed cases are members of the same family or related? Is that something you could share? Or
I don't have that information now. I mean, we tend to track this more at like a facility level, like with long-term care facilities. Certainly, we have information if like a family member comes down with infection, we would classify that as a close contact to a confirmed person with confirmed COVID-19. So we do track that to some extent, but I don't have those numbers to share right now.
Governor, I got a question about volunteers. So you have all these people who have now signed up. Have they been specifically assigned tasks to date, and how will it work with them?
So many of them have. Yeah, many of them have. Not everybody. I mean, it depends where you are, what your what your opportunity to volunteer might be, and what community you're in. Where the need is in the community. If we have a lot of folks in COAS, let's say, where there's I think maybe still one or very few cases up in COAS, there's probably not as high of a need, so those folks are kind of waiting in the wings. But if you're looking to volunteer down in the southern tier, my sense is that you've probably been asked to do something in some respect. But Volunteer New Hampshire has been managing that for.
I imagine it's safe in the sense that they're not supposed to go out, but they can do this.
Yes, one thing that we do assure is that the safety of everyone. Look, sometimes it might just be grocery shopping for an elderly individual in the neighborhood, and just being able to go out, get the groceries, follow the list, and leave the groceries on the front step, whatever it might be. But no, we try to maintain a good physical distancing for those folks as well, in as many aspects that we can. I think we have a few. Do you want to do one more, Adam, and then we'll take some on the phone.
Just in terms for Dr. Chan, the number of confirmed positive who are under the age of 18, do we have a number on that?
We do have a number. I don't know the exact number right now. I think it's around 10 or a little bit, maybe a little bit under 10.
And in
But
terms
we
of
can
the model that shows potentially 400 deaths, what's the duration of that model? That's over how many weeks or months are you looking for that total number?
I'm sorry, can you ask that again about?
With the model that shows potentially up to 400 deaths for New Hampshire, what's the time frame on that model? When would that last death occur?
You're talking about one of the first slides I showed that showed a decrease in the deaths from like 800 to 400, for example, correct? Let me go back to that slide. Again, I want to just emphasize again that this, there we go. This is meant to be simply an example of how community mitigation and social distancing can work. So this is meant to convey a possibility, but this is unlikely to be what actually happens in New Hampshire. And so what this is meant to demonstrate is that with effective community mitigation, we can cut the number of people who die from COVID-19 at least in half, possibly, likely, more than that. Over what time frame? Again, these are just rough estimates. But this is assuming, the 20,000 infections at the peak of the outbreak. But this isn't based on necessarily one specific scenario.
In 18 months, I guess is that until a vaccine, or there's a
Right.
time frame there, right? Day since first case, how many days?
I'd have to go back and look at what the model shows and the data. I don't have an exact answer for you. Sorry.
Great. We'll do some. We'll take some questions on the phone.
Our first question comes from Paula Tracy with InDepth. Paula, go ahead with your question.
Yes, good afternoon. I have a question about the signs on the highway the governor mentioned yesterday. I'd like to know a little bit about what the messaging is going to be and who it's aimed at. And then I also have a request for the future that Dr. Chan might be able to help us with. Is it possible to get age group breakdown for the COVID cases by counties in the future?
So let me take those two questions. One has to do with the highway signage that has already become active. They're out on the roads now. The highway signage is very clear. It's aimed at out-of-staters that are looking for an extended period of stay here in New Hampshire, whether it be at a second home. We have, again, closed the hotels as well as Airbnbs. But if folks are coming up here for an extended stay, the signage is very clear. It says that you are, we do ask you to quarantine for 14 days. So it's just reiterating that message and elevating it on all of our electronic signs, specifically around those gateway points, Route 89 into Vermont, or 93 or 95 out of Massachusetts in particular, and a variety of other roads as well. But it's really kind of those gateway points for our long-term out-of-state visitors. Secondly, in terms of the ability for the state to provide a demographic, more detailed demographic data by age and county, we can absolutely provide that.
Our next question comes from Michael Graham with Inside Sources. Michael, go ahead with your question.
Yes, I have a question about the elections, one for Dr. Chan and one for the governor. Dr. Chan, what is the metric that would be used to determine whether or not New Hampshire could have something like traditional elections where people go and get ballots either by September 8th for the primary or by November? And then Governor, you've seen the push for changing the way that we do our elections from online voter registration to mail-in ballots to ballot drop-offs with no ID required. You just drive up and drop your ballot in. Do you think that that would be appropriate for the pandemic vote if we are still voting under these circumstances, or any of those non-starters for you even under the current circumstances? For example, online voter registration with no ID.
So I'm going to answer both questions. The Department of Public Health we're not looking to ask them to set a specific metric on what the data should look like in terms of how we manage our election process. More specifically, I think to the questions that have been raised over the past few days about elections and what they might look like. Again, let's understand most elections in the state are still months and months off, September and November. So we are way far away. We don't know what the situation is going to be come September and November. The Secretary of State and the Attorney General are releasing guidance that talk about specifically two things. Number one, the ability for folks to vote absentee if they so choose, based on the COVID epidemic, and our state has an immense amount of flexibility. Basically, if you feel more comfortable voting absentee because of the outbreak or your inability or nervousness about just appearing in person to vote, you can vote absentee and obtain an absentee ballot. So we have a very flexible system, and I think the Attorney General and the Secretary of State have done a very good job ensuring that security for individuals across the state. There may be other guidance that both the Attorney General and the Secretary of State may be putting out concerning other variables around in-person voting, whether it be the potential for drive-up voting, where again you'd still show your ID, you'd show your identification as is required. We've had some models where you can potentially vote by the car and put it in, your optical scanner all from your car to ensure physical distancing. There are some areas where that might work and some areas where it wouldn't. But it would all be done with the protections that are already in place for voter certification and in terms of making sure that voter is verified on the voter rolls. There's some other flexibilities and guidance that we're asking them to put together. For example, when you go into a polling location, making sure that the actual booths that you vote in are physically distanced appropriately, and public health will be involved with making sure that what is appropriate from a public health standpoint to ensure the safety of the individual casting the vote is something that is included in those guidance documents. There's a variety of different guidance that we could put in to make sure we want folks to feel safe when they walk in, but even if they don't feel safe going, they will have the ability to vote by absentee.
Our next question comes from Holly Raymer with Associated Press. Holly, go ahead with your question.
Hi, thank you. Now that federal officials say that the national stockpile for PPE and ventilators is depleted, what will the state do now? Are you forming alliances with other states to get these supplies?
So the question is, what is the state's approach, given the announcement from the federal government that the majority of the national strategic stockpile the strategic national stockpile of PPE has been depleted. We've been pursuing other avenues of PPE since day one, since as soon as we heard about and understood the severity of the nature of this, whether it's out of the commercial market, whether it's overseas, whether it's partnering with other states. So we've been scouring literally the planet for a variety of PPE, and we've been very successful in many ways. We have commercial partners that have been assisting with us. We find that a lot of the best opportunity to bring overseas product into New Hampshire are using the relationships that many of our private sector commercial partners, like SoClean, we talked about that one last week. SoClean is literally bringing in about 20,000 masks a day for New Hampshire and for our healthcare providers, and they've been just a great source for us. There's other commercial partners as well. They had already established relationships overseas, and so they were able to exploit that and bring those products in as soon as possible. The commercial markets here within the United States have been flexed open a little more for states. Originally, we really couldn't even put in orders with a lot of those commercial markets. Everything was going to FEMA. Now states can actually go out and make our purchases, and we have a lot of folks that we can purchase from. We were on the phone with the folks from Thermo Fisher just a couple hours ago, talking about getting supplies for testing and other PPE supplies that that company, a great company down in Massachusetts, can provide to the state of New Hampshire. So we've been scouring since day one, and I think we're in a pretty good shape. We don't know exactly how long this is going to be. We don't know exactly how big the surge or next surge could last. So even items that we feel very comfortable that we have, we're always looking for more. It's important to note that no healthcare facility or hospital has said they are out of PPE. That has not been brought to our level at all. We keep doling out both what FEMA had given us. We still have some more left, and we can keep making sure that PPE is getting to the front lines. We have other commercial opportunities that are literally coming in almost daily, which are great. We got some more gowns that we weren't even expecting. We got a lot of gowns, which are a very high need item in the state just yesterday. So we're turning over every stone, and we are having some success. Great. So that does it for the questions over the phone. So again, just want to thank everyone for joining us today. Thank you, Dr. Chan. Always a great presentation. I think it's very useful for the folks of the state to be able to kind of see some of the variables that we're looking at in terms of figuring out where this is going to go. Very unknown. Again, I think one of the biggest takeaway I want to emphasize for myself, and I think I speak for Dr. Chan, is the social distancing, the physical distancing, and the mitigation requests and demands that the state has made of individuals and businesses and the school children across this state. They are huge sacrifices we're asking people to make, but they're working. Initial data indicates that they are working, and if we keep that up, if we can keep on that path, and it could be for an extended period of time, that's one of the best tools that we're going to have in terms of really reducing the viral suppression across the state. So we have to stay, we have to have the stamina. We have to be in it for the long haul. The people of the state so far have done a great job, and again, we just want to say thank you, and let's keep it up. And if we do, we're going to get out of this faster than most and get our economy back on track, I think, in a very quick way. Get back to normal, whatever normal might look like. It might look a little different on the back end, but we are going to get back to normal one way or the other, and I think here in New Hampshire we're going to do it in pretty short order. So thank you guys very much.